G'day everybody, Brad Williams here again from Williams Occupational Therapy Driver Assessments and Rehab. Today I've got a little bit of an educational piece. This is specifically designed for our referrers. We're having a couple of troubles recently, especially a client that I can think of this week, where their mindset wasn't in the right place to come and do the driver assessment, and we had to work through a lot of pre-conversation about trying to help the client understand why they'd been referred for this driving assessment in the first place. And it really came down to the fact that they felt like they were having a license assessment like a learner going for their P's for the first time. So they're feeling like they're going right back to the start when they were a 16-year-old and being put under the microscope about their ability to drive. We need to reframe this. We need to have our referrers and our doctors and our GPs and our medical staff to help us with this and reframe the referral when they're talking to their clients. It's not a license assessment like it is for you going to get your L's or going to get your P's. It's not like that. And if you need a kind of assessment, then you need to refer to the Department of Transport. Our assessment, an occupational therapy driver assessment, is different to that. It is an assessment of their function, just like it would be if you were referred to an OT for a daily living assessment. So going to their kitchen and seeing how they go about cooking their food, or having a look at their bathroom to see if they're safe in their bathroom and putting in rails or whatever it might be to help them get on and off the toilet or in and out of their shower. It's also similar to referring to a physio. So referring to a physio for somebody's walking ability, and the physio might install or look at walking aids such as a forward walker, a rollator frame, a single point stick or 4-point stick. You send off to the physio for that expert opinion on how this person's going to be safe with their walking into the future. A driving assessment in the context of the OT world is very similar to this type of framework. We assess the client's function in the task of driving. There's a very distinct and important difference between that and a driving assessment through the Department of Transport and a licensing assessment. We need our referrers to help us reframe this so the clients are coming ready to participate. And that would make a huge difference to our world as an occupational therapist doing driver assessments. That distinctive difference is it's a driver assessment. We're assessing the driver's function. It's not a driving assessment where we're looking at licensing quality. So, if you could talk to your clients about this, we are all about safety, just like a physio would be about safety in walking, or an OT would be about safety in the kitchen or in the bathroom. But we want people to be able to be doing driving in the most appropriate way for their function, for their disability, for their medical issue. So we're trying to enhance the task of driving. And what we're trying to do is help them stay on the road for as long as possible in the safest way possible. We're not looking to take licenses away. That's not our primary objective. Okay, yes, sometimes we cannot overcome a hurdle, and the recommendation may be that the license should be medically suspended or revoked for the future. But that's not what an OT driver assessment is all about. We are always looking for the positive outcome, and we are always looking to try and have somebody maintain their function at the highest level so they can stay safe on the road, so they can return to their family, and they're not going to impact on anybody else on the road as well, or the passengers in their car. I really hope this helps all of our referrers to help us reframe the idea of a driving versus driver assessment, because we think that it's really important for that continuity of care, and so you can keep your rapport with your clients, but also so we can start that positive outcome right from the start. I hope this really helps. If you've got any queries, make sure you get in contact with us here at Williams Occupational Therapy Driver Assessments and Rehab. You can Google that, you'll come to our website. There's a whole heap of information on there about what a driver assessment is. So go and visit our website or give us a call or give us an email, and we can help you out a little bit further. I hope you enjoy this beautiful day. You can see that sun coming in on me there. I'm looking forward to getting out on the road today. We've got a client who's going on with learning how to use some hand controls, and then we've got a client who has got foot drop, bilateral foot drop. So we're looking at her pedal control. That's a learner driver learning for the very first time. She's super excited. And then after that, we've got another assessment for somebody else older in life with foot drop on the right hand side. So we're looking at his ability to control the pedals. That's really exciting. And then we've got a long-term client who's looking to get back that independence. Can't wait to get the day started, and yeah, see you out on the roads. Have a good day.